Welcome to the Plastic Surgery Playbook.
So glad to be here.
It's kind of like walking into an auto mechanic with a sketch of a levitating car from a sci-fi movie and like asking them to just install the anti-gravity drive.
Right, which they would obviously laugh at.
Exactly. I mean, the blueprint looks great, but the physics just don't exist. And today, for you listening, whether you're curious about aesthetics or tech or just human psychology, we're exploring this wild intersection of artificial intelligence and plastic surgery because this exact scenario is playing out in clinics right now.
It really is. I mean, we are witnessing this massive collision, right? You have the limitless possibilities of AI just manipulating pixels on a screen, crashing right into the very rigid, unforgiving realities of human anatomy.
Yeah, and we have a fantastic stack of source material today to help us make sense of it. We're pulling from this standout YouTube video from Dr. Shim Ching, who's a board-certified plastic surgeon in Honolulu, Hawaii.
A really great resource.
Totally. Plus, we've got comprehensive research from the American Society of Plastic Surgeons, an eye-opening review from the medical journal Frontiers in Surgery, and this really shocking investigative piece from The Guardian.
Yeah, and, looking at all of this together, it's clear that technology is completely rewiring patient expectations long before they even step foot in a clinic.
Which brings us to the whole selfie thing. I mean, the American Academy of Facial Plastic and Reconstructive Surgery noted that like 72% of facial plastic surgeons have seen patients who just want to look better in their selfies. They call it Snapchat dysmorphia.
Right, but that was just the beginning.
Yeah.
I mean, it has mutated into something much more intense now. We're dealing with what surgeons call AI face.
AI face. Wow.
Yeah. Patients aren't just using a slight blur filter anymore. They're going to AI chatbots and image generators like ChatGPT or Nano Banana.
Banana.
Exactly, and they're creating these flawlessly symmetric but physically impossible after photos of themselves.
I can't even imagine how frustrating that must be for the surgeons. I mean, our sources quoted Dr. Stephen Williams, right, and he summed it up perfectly.
Oh yeah, his quote is spot on. He basically said, "Pixels are easier than surgery, and bodies aren't clay."
Bodies aren't clay. That's such a good way to put it.
It is, because, well, an AI is just rearranging digital squares. But human tissue has a blood supply. It reacts to gravity. You can't just stretch skin over a massive AI-generated chin implant without consequences.
Right, the physics just aren't there. Which actually reminds me of this really wild story we found from The Guardian.
Oh, the Isaac Tompkins experiment.
Yes, so this journalist, Isaac Tompkins, uploads his photo to an AI chatbot and basically asks it to give him a more masculine face. I think his exact prompt was, make me look like more of a Chad.
Which is just, I mean, from a medical standpoint, ridiculous.
Totally. And the AI didn't just give him a new jawline. It recommended this massive laundry list of procedures. What was it? Buccal fat removal, chin implants, a neck lift, and ablative laser resurfacing.
Right. Which, by the way, would cost over 100,000 pounds.
100,000 pounds.
Yeah. But the cost isn't even the worst part. When he took this AI surgical plan to an actual surgeon, Dr. Alex Caritas, the medical reality check was brutal.
What did Dr. Caritas say about it?
Well, first off, the AI completely failed at basic anatomy. It suggested a brow lift. But the photo actually showed his eyebrows had been lowered to make him look more brooding.
Wait, so the AI prescribed a lift but actually pulled the brows down?
Exactly. It didn't understand what the surgery actually does. And it recommended unnecessary chin implants. But the biggest red flag was the buccal fat removal.
Right, the cheek fat. Why was that such a big deal?
Because the AI doesn't understand aging. If you hollow out your cheeks at 25 for a sculpted look, Dr. Caritas pointed out that by the time you're 50, you're going to look incredibly gaunt.
Oh, wow. So it's just optimizing for one photo today and ignoring what happens a decade from now.
Exactly. And, we see these viral anti-aging AI videos where people look amazing, but if you look closely, the AI gave them six-fingered hands.
Oh my gosh, yes.
Because the AI doesn't know what a human is. It just knows pixels.
Which honestly leads to something else I noticed. Like, if AI is doing all this based on mathematical pixels, is it just making our concept of beauty more boring and homogenized because all these AI images kind of look exactly the same to me?
Yeah, that's what we call the Bratz-Dahl effect.
The Bratz-Dahl effect. Okay.
Right, because the AI is trained on very specific, heavily filtered social media data. So the research from Frontiers in Surgery and the ASPS articles point out that these algorithms reinforce strict racial and gender biases.
Ah, so it's applying like a one-size-fits-all filter.
Yes, exactly. It defaults to highly westernized beauty ideals. So for women, It always spits out this V-shaped jawline, massive eyes, and the OG curve along the cheekbones.
Wait, the Ochi curve.
Yeah, it's that subtle S shape on the cheek when you view a face from an angle. It's nice, but the AI forces it onto every single face, totally ignoring an individual's unique ethnic characteristics or bone structure.
It just wipes out human diversity completely.
It does. It forces everyone into the same mathematical template.
Okay, so if the AI doesn't understand diversity, and it's giving people 6 fingers and recommending 100,000-pound surgeries that age terribly,
Right.
does it even belong in a plastic surgeon's office? Like, why are they using it?
Well, this is where it gets really interesting and where we have to look at Dr. Shim Ching's perspective.
The surgeon in Honolulu.
Exactly. In his video, he explains that the biggest lie about AI and aesthetics is that it's going to automate the job and replace the surgeon.
Like a robot just stamping out Bratz doll faces.
Right, but that's not what it does. Dr. Ching says AI is actually the most powerful tool ever created for hyper-personalization.
Hyper-personalization. How does that work if it's so biased?
Because in the clinic, it's not being used to design a new face from scratch. It's being used to do the complex math on your specific anatomy. Dr. Ching makes this great point. The AI doesn't understand beauty or emotion. It's just a calculator.
Okay, I love that quote from him, actually. The surgeon provides the judgment.
Yes. The machine can measure your jaw angle to the millimeter, but the surgeon is the driver. The AI is just the roadmap.
So what exactly is on this roadmap? Because our sources mentioned 3 really specific superpowers AI has in the clinic. Let's start with the first one, which Dr. Ching called the longevity predictor.
Right, so the biggest challenge isn't how you look at 6 months. It's how you look in 10 to 15 years.
Which the chatbot totally failed at with the buccal fat removal.
Exactly. But clinical AI can analyze variables like your specific skin thickness, your tissue elasticity, and your bone structure.
Oh, wow.
Yeah, and then it compares that against thousands of long-term outcomes to predict how a surgery will age on your face over time.
So it's literally modeling the future of your face.
Exactly, and that ties into the second superpower, vectors and revisions.
This was about things like revision rhinoplasty, right? Like fixing a previous nose job.
Right. It's super complex. A tiny change in the vector, like the angle of a cartilage graft, changes everything. AI lets the surgeon simulate countless surgical approaches to see exactly how that vector will affect the long-term stability of the nose.
That is incredible. And the third one is scars and healing, which, I mean, healing is always so unpredictable.
Right, because of genetics and tissue behavior. But AI analyzes huge data sets on those exact factors to predict your individual risk for scarring. So it actually guides the surgeon on exactly where to place the incision for your specific skin.
So it's doing all this invisible math to keep you safe. And the Frontiers review backed this up, right? It said AI models have an 88% overall diagnostic accuracy right now.
Yep, and a 90% accuracy in post-operative evaluation. Plus, the ASPS noted it's revolutionizing practice management.
Like digital scribes during consults?
Exactly. And tools like Open Evidence, which parse complex research for the doctors.
Okay, but wait, let me jump in here. Because if the AI is hitting 88 to 90% accuracy in predicting these outcomes, why aren't we just letting the algorithms make all the calls?
Well, that's the catch.
Why do we even need Dr. Ching if the math is that good?
Because of the flaws pointed out in that same Frontier study. That 90% accuracy comes with a huge asterisk, a lack of external validation.
Meaning what, exactly?
Meaning the AI is often only tested on the same type of data it was trained on. If a hospital trains the AI on their specific patient demographic, it looks like a genius. But if you take that same AI to a different clinic with a diverse population, it fails.
Oh, so it's that algorithmic bias popping up again.
Exactly. It fails on diverse populations.
Yeah.
And, maybe more importantly, AI cannot account for live, on-the-table surgical complications.
Like if a patient's blood pressure spikes.
Right. Or if the surgeon opens the skin and finds unexpected scar tissue. A digital simulation assumes a perfect environment. It can't feel the tactile resistance of the tissue.
Right, because bodies aren't clay.
Exactly. The algorithm can't make those real-time, split-second safety judgments. Only a human surgeon can do that.
So to kind of summarize all this for you listening, AI in plastic surgery really is this massive double-edged sword.
It really is.
On your smartphone, it's creating Snapchat dysmorphia. It's giving us these impossible AI face expectations that ignore human anatomy. But in the hands of someone like Dr. Shim Ching, it's this incredible calculator for longevity.
Right. It helps predict how you'll age gracefully over a decade.
But it does leave us with a pretty wild thought for the future.
Yeah, as these simulations get more and more advanced, you have to wonder, will we eventually reach a point where that digital before and after photo is so accurate that it becomes a legally binding contract between the patient and the surgeon?
Wait, really? Like, you could sue if you don't look exactly like the render.
It's possible. And even beyond the legal side, what does that do to human self-esteem? What happens when your digital twin, the perfectly optimized AI version of you, looks better than you ever could in real life?
Man, that is definitely something to think about next time you go to use a beauty filter. Thanks for listening to the Plastic Surgery Playbook.